And welcome back. His program has cured 400 people of viral hepatitis last year alone. Very impressive. He joins us right now, Dr. Curtis Cooper with the Viral Hepatitis Program at the Ottawa Hospital. Hello, Curtis. Nice to see you here.
Hi, how are you doing?
Good. Great to have you here. I mean, curing 400 people in 1 year is pretty decent.
Yeah, it's very gratifying.
Congratulations on that.
I've got a great team that makes all of that happen.
Okay, so can you tell us what exactly is viral hepatitis?
It's an infection. There's a number of different ways that you can become exposed and infected with hepatitis C. It gets into your liver, and over years it causes scarring and inflammation in the liver that eventually can lead to liver failure, liver cancer, and the need for liver transplantation.
So not good.
No.
Not good to have hepatitis.
No.
What are some of the ways people can contract hepatitis?
So injection drug use is the #1 cause of people becoming infected these days. Rarely you can get it through sex. In the old days, there are issues with blood transfusions and contaminated blood. That's no longer a major concern.
Okay. Yeah, okay. So how many people in Canada are living with this?
In Canada, there's about 250,000 people living with hepatitis C.
Wow.
And the concerning thing is that only about 40% of them know that they have hepatitis C, which means there's people out there that every day their liver is getting a little bit more damaged and they're at risk for these bad outcomes.
Okay, so the Ontario Ministry of Health had a recent announcement that was good news. So
yeah, very important
news
for people living with hepatitis C. In the last couple of years, we've developed excellent new treatments for hepatitis C. They're safe, they're well tolerated, they're only 8 to 12 weeks in duration, and they cure well over 90% of people who take the medications. And now the province is reimbursing everyone living with hepatitis C for these treatments. Prior to the end of this February, only a portion of people who had enough damage in their liver would qualify for funding. Now it doesn't matter how much or how little scarring you have in your liver, everybody qualifies.
So how much would the cost usually be? I mean, how much are we talking here?
Well, a couple of years ago when these medications came out, the price tag was around $80,000 to $90,000. Now, because of negotiations between the provinces and the pharmaceutical industry, the prices dropped considerably. It's somewhere in the range of $20,000 to $30,000, but that exact figure is not public knowledge.
It's still nice to be covered, though.
Well, absolutely.
Yeah.
It removes one of the many barriers along the cascade of care. So now people don't have to worry about whether they can come up with the money to pay for these treatments.
Okay. Can you tell us about some of the drugs that are used? So some new drugs are out there?
Sure. Well, there's a number of different medications. They're 1 pill a day in many cases, or 2 or 3 pills once a day. They are combinations of medications that target the virus and shut down its life cycle, so eventually it dies out and you can get rid of the infection. One of the medications is called Epclusa. There's another one called Zepitir. There's another one called Mavorite. They're the 3 major ones that are currently available.
I mean, how committed is Canada to eliminating hepatitis?
Well, the fact that the provinces are getting on board and covering the expenses, that's a really positive. The fact that some of the provinces through the medical care system, are covering the cost of running viral hepatitis programs, that's important. I think a big area where we're not there yet is screening the population. We have no national strategy for this, and because we don't have a strategy, we're not screening the population, so there's people out there that don't know that they have hepatitis C and remain at risk of dying from some of these really bad outcomes.
Okay.
So if we can screen nationally, then we'll know who has it, we can get them engaged in the care that they need, get them on this excellent treatment, and get them cured.
Okay, so who are some of the high-risk populations then in Canada, people most at risk for contracting?
So the honest answer is that everyone is at risk for being exposed to hepatitis C. So I think the best way to go forward is just to screen everyone. It removes the stigma of saying, you injected drugs 20 years ago. That creates stigma, and that makes people hesitant to proceed with screening. If we just say, hey, everybody gets screened, I get screened, you get screened, it normalizes it, it reduces the stigma, and in a couple of years, everyone has a blood test over a 3 to 5 year period of time. You screen the population, you identify those who have it, and then you get them the care they need. Now we should focus on specific populations, those who are past or current injection drug users. We should try and get those folks screened, because not only can you help them by clearing their hepatitis C, but you can potentially prevent numerous cases from people who they share with. We should also be screening in the incarcerated populations.
Okay, totally. And I know we're probably out of time here. We only have about 30 seconds, but you're also developing a unique program at the Ottawa Hospital as well.
Yeah, 20% of people at the provincial correctional centres, including the OCDC here in Ottawa, are hepatitis C infected. We're working with our partners there at the OCDC to develop a program where we'll screen anyone who wants to be screened and get them engaged in our program so that they can get the treatment that they need, so that they don't have to live with the stigma and the fear of these bad outcomes in the future.
Perfect. Thank you for everything you're doing. Think ottawamedicine.ca for more details.
Great. Thank you.
Dr. Curtis Cooper joined us right here on Daytime. We've got more coming up on Rogers TV.